Hi everyone, I'm Eric Vanderwall from Gut Well Now. I completed my Doctor of TCM program, acupuncture, Chinese herbal medicine program in Canada where I'm originally from. I also hold a master's degree in medicine and I'm a trained shiatsu therapist. Today we're going to be talking briefly about prokinetic agents and their relationship to SIBO. So if you're not sure what a prokinetic is, this is the right talk for you. And I just want to start off by saying, if you've been diagnosed with SIBO and you're not taking a prokinetic agent, then you may be fighting an uphill battle and losing. So we're going to talk about why. Just a quick disclaimer for you, this talk and handout contains general information about medical conditions and treatments. This information is not advice and should not be treated as such. You must not rely on this information in this talk as an alternative to medical advice from your doctor or other healthcare provider. If you think you're suffering from any medical condition, you should seek immediate medical attention. Now, what is a prokinetic or a prokinetic agent? A prokinetic is a substance that increases gastrointestinal motility by stimulating the strength or the frequency of contractions in the small intestine. These can be herbs, a combination of herbs, or drugs. For our patients, we work exclusively with single or combination herbs with supplements to achieve a good long-term effect. We're not going to really be talking about drugs at all today. A common question that comes up about this is they hear the word motility and think, I have diarrhea. Why would I want to increase my motility? So if you've been diagnosed with SIBO, small intestine bacterial overgrowth by the way of a hydrogen breath test, then your diarrhea or constipation is due to an overabundance of bacteria living in the small intestine, not necessarily an excessive amount of gastrointestinal motility in the small intestine. In fact, more than likely, your motility is impaired. Poor motility may be a primary factor for SIBO or a secondary one. Once motility is impaired, this allows food to stay in the small intestine longer than is desirable and feeds the bacteria in this part of the gut. This abnormal bacteria builds up and leads to diarrhea or constipation, which results in fat, protein, carbohydrate, and vitamin malabsorption. In addition, it can be the underlying cause of chronic inflammation, autoimmune disorders, and chronic pain by damaging the structure of the intestinal wall. So it's estimated between 33 to 67% of all cases of chronic diarrhea have been associated with SIBO. And SIBO is a highly treatable condition with the correct herbs, diet, supplements, or if you're seeing a Western medical doctor, drugs. So if you're looking for any references for these statements, you can find them on our website, and they'll link back to the research. Now, you may be thinking, how do I choose the right prokinetic? Well, your prokinetic choices should follow your symptoms and signs, as no two people present in exactly the same way. So, for us, we often apply Modal Pro, which is a product, or Ibogas, which is also a product, which contain herbs. We also use a combination of Chinese medicine and a custom herbal formulas to stimulate the small intestine movement. Both Modal Pro and Ibogas are quite popular options, and they're available over the counter and have pretty good safety profiles. Again, if you check our website, we have some links to more information about this. Now, these are a few single prokinetics that we've used, and these are just three of actually many different prokinetic agents. And the first one is ginger, which is the most popular one that you may already be familiar with. The second one is a Chinese herb called zhizi. Zhizi is Z-H-I-Z-I. Thirdly, we also use a Chinese herb called jinyanhua, which is a type of flower. It's actually a type of chrysanthemum flower. Next, we usually apply these prokinetic agents in a formula of herbs as they tend to be more effective than just one single herb. That being said, if you're new to this and you're trying things out, a lot of our patients benefit just from using ginger alone or in combination with other things. It's fairly easy to get dried ginger capsules these days, or pellets, as they're often used for seasickness. So the first popular formula that has some research backing it up is a Chinese formula called SIBO. The second one is also a Chinese formula, which is even more popular in China. It's called Le Junzi Tang. Third, we have the Japanese herbal formula called Dai Ken Chuto. And lastly, we have the Indian formula of 3 herbs called Triphala. And I hope I'm pronouncing that one right. Just to quickly summarize this talk, a prokinetic or prokinetic agents are substances that increase gastrointestinal motility. In almost all cases, prokinetic agents should be used as part of a SIBO treatment. So again, talk to your healthcare provider about this and see what they can do for you. Herbs can work as effective prokinetics and have a long history of use throughout the world. Prokinetic choices should follow your specific symptoms and signs. This is not a one-size-fits-all approach. If you'd like more information, you can contact us online at www.gutwellnow.com. That's GUTWELLNOW.com. My name's Eric Vanderwall, and we specialize in the treatment of gastrointestinal disorders, both of the upper and lower digestive tract and associated disorders around that, using traditional Chinese medicine and functional medicine. Thanks for listening today, and don't forget to check out part 2 of this talk called How to Choose Herbal Prokinetics According to Chinese Medicine.